Hello learners, Dr. Paul here with a video summary for Unit 2. I will be doing these video summaries from time to time because they allow me to expand on certain ideas and concepts that we're talking about in the course room. And for this unit, there'll be some overlap with the last unit as well as far as some of the things I'm going to talk about. So you're being introduced to the systems metaphor, or sometimes you hear the term systemic. And systems or systemic way of thinking is very different than the way most of us were raised to think in a sort of linear cause and effect way. From a systemic epistemology, if you will, the term epistemology just meaning a theory of knowledge. From a systemic epistemology or a systemic perspective, we see the interrelationships of the parts, and in our field that means the interrelationships of people, and the prominence of the idea of context, that you can't look at a behavior or a symptom or a presenting problem without looking at the wider context of which, if that context did not exist, then the symptom would no longer exist. And so the early family therapists, using the metaphor of systems, were able to then map out, when they met with families, the different ways that people interacted with each other to maintain traditional psychiatric symptoms. This was a radically different way of thinking about mental health and pathology. At the time, our culture was steeped in ideas of psychoanalysis and behaviorism, but it was all focused on the individual. And so when there was a problem with a person, it was their problem. And to the extent that the environment was looked at, it was looked at as causing problems for the individual. Not necessarily that the individual was part of a context that could maintain and sustain those symptoms. So the early family therapists were pioneering in that they looked to a different metaphor to understand how people were presenting with psychiatric problems and how to understand those symptoms in context. The phrase first order cybernetics, essentially, to kind of crystallize it, means when the early pioneers worked with a family, they believed that they were apart from the family. And so there was if you will, an invisible barrier between them and the family, meaning that they were an expert standing apart from this system, much like a mechanic stands apart from the engine they work on. And so a first order cybernetic perspective only viewed the family as a cybernetic system that obeyed certain rules and performed certain functions, etc. Well, when you apply the idea of cybernetics to the therapy process, the idea of second order cybernetics came into being. And this was a higher order of cybernetics, meaning that if we're thinking in terms of a system, a family is not the only system that we encounter, the therapeutic system. And the therapeutic system might include teachers, other therapists, police officers, probation officers, other physicians, etc. But for our purposes, the second order cybernetics basically took the circle around the family and put it around the therapist as well. And that opened up so many possibilities for family therapists to intervene in different ways. Because from a first order cybernetics perspective, I might see an intervention like teaching communication skills, or teaching parents about timeout or behavior charts. From a first order perspective, that kind of linear change, let me teach you something, I'm going to, from outside your system, try to affect change in your system. Again, like the mechanic with the engine. From a second order cybernetics perspective, though, we could no longer view interventions in the same way. And the interventions that the family therapist started to embrace included themselves in the process. So for example, we noticed that every time we introduce the possibility of a family changing, we're met with some resistance or we're met with some opposition. So every time we introduce a change behavior, we get stability from our clients. So with a second order cybernetic perspective, it's a therapist is always examining their own behaviors and their own input into the system because they're part of that system. So a more second order informed intervention might be, every time that I talk with this parent who has several children that are, say, out of control and they are struggling with keeping control of their kids, instead of teaching that parent parenting skills, which would be a first order cybernetic perspective, we're going to look at ways of framing what's going on with this parent. Possibly that this parent is really good at showing a lot of love and providing a lot of freedom and maybe a lot of permissiveness. And we might punctuate how wonderful that is, that her children are free to roam around and free to make their own choices. Well, that's a message that's punctuating the stability of their situation. And so we notice as a therapist, if we punctuate the stability, oftentimes the system or the family system starts to reorganize around change. So the point of the second order perspective is that we're including ourselves in the process. We're not standing apart from a family as experts saying this is how you should behave or this is the solution to your problem. We're always including and folding into it the types of questions we're asking, what we're focusing on, the kinds of interactions or the kinds of dialogue or the subject matter that we ask questions about takes on a life of its own. And so being mindful of what we bring to the table as part of the therapeutic system is a much more of a second order cybernetic perspective. It's important to keep in mind that first and second order cybernetics, these are theoretical ideas. There's not necessarily a first order intervention or a second order therapy. They inform us. They're ways of thinking about therapy, but they're not necessarily the practical tools of therapy. When you're sitting with a family, you're not thinking, okay, what's a second order intervention or this is first order therapy. It's more, again, a way of talking about the therapy process. The other very fundamental idea that has been very profound in the family therapy field in particular is the idea of constructivism or social constructionism. And these are two terms that can be used interchangeably for our purposes, although if you were to study these more extensively, you would see some distinctions in the traditions that they come from. But basically, this is the idea that meaning and reality are constructed much more than they are discovered or that they are independently available to us. And if we just plug into that one reality, that's the true reality, that's what's real. A constructivist or social construction perspective focuses on multiple realities, and that language is a central tool that we use in order to construct belief systems and contexts that make certain realities truer than others, or true for some people and not for others. And if you think about it, it makes sense. As you're meeting with a family, there are multiple perspectives. And so even the same children being raised in the same family or different children being raised in the same family have different realities. They're experiencing that family very differently. And so this idea that there are multiple perspectives is a very freeing idea for us as therapists, because we're able to connect with and adapt to the reality that our families come in with, and also pose other perspectives that leave openings or room for new perspectives and new realities to emerge. So this is really important because they inform ideas about non-pathology or a non-normative stance, which are cornerstones to family therapy. The pioneers of family therapy were very invested in the idea that individuals shouldn't necessarily be labeled. And they worked very hard to turn those labels into a systemic process that occurred between people. There are a lot of new ideas that we're sharing here, and they're dense ideas. And embracing some of this way of thinking or thinking more relationally or systemically doesn't happen overnight. This course is an opportunity to begin to introduce you to some ideas that you could really spend a whole semester on. So be patient with yourself. Again, these ideas are dense. You need to sit with them for a while. And there are more ways of beginning to think about the therapy process rather than informing our actual moment-to-moment therapy with our clients. So I said a bunch there. Hopefully there was some clarification for you. After you view this video, just reply to it that you were able to view it, and possibly a follow-up question for me, or maybe something that the presentation sparked in you. Okay, see you again soon.